In this video, I want to talk about anxiety disorders. We've all experienced anxiety. We all know what anxiety is. But when does anxiety become a disorder? So, we're going to talk about some of the major anxiety disorders and the difference between normal anxiety and actual anxiety disorders. So, we definitely all experience anxiety, but anxiety disorders are excessive fears, excessive anxiety, and anxiety that persists over a long period of time. Many of us, we get stressed. We know we're stressed. We know, what we're stressed about. And generally we can actually control a lot of those stressors as well. But with anxiety disorders, oftentimes people have anxiety and there's really nothing necessarily to be stressed about. So we'll talk about that. So anxiety disorders are actually one of the most common psychological disorders. About a third of the U.S. population will meet criteria for an anxiety disorder in their lifetime. So in this chapter, we're going to cover several of the anxiety disorders. We're going to talk about specific phobias, which are actually the most common anxiety disorder, and probably the most common disorder overall, it looks like, at 8.7% of the population. We'll also talk about social anxiety disorder, which is quite common as well, generalized anxiety disorder, and panic disorder. In another video, I'm going to talk about obsessive compulsive disorder and also causes and treatments of anxiety disorders. So specific phobias are phobias about a specific thing. So either a phobia about spiders, you could have a phobia about clowns, you could have a phobia about flying or heights. It's an irrational fear, and a lot of times people with phobias will avoid whatever it is that they're afraid of, or the situation that they're afraid of. In order to avoid anxiety. So we use the term specific phobia now instead of using those terms. If you guys remember, arachnophobia was fear of spiders. I think there was a movie called that. We don't use those terms anymore because it was a lot to memorize, a lot to know. I couldn't tell you what fear of clowns is, but I can tell you that a person has a specific phobia about clowns. So that's the way we diagnose it now. The person has a specific phobia about flying, and we don't use those fancier terms anymore. It clarifies things a little bit. So people with phobias realize that their fears are unreasonable and excessive, but they can't control them. They just feel a sense of panic when they see a picture of a clown or a spider, or they think about flying somewhere. I had a student that was petrified of just this picture of the clown, and I don't know if this is the clown from the original It, but she had seen the original It with her brother when she was a little kid, and was pretty scared by it. And so ever since then, she's been petrified of clowns. And so even looking at this picture really bothered her. So that was really interesting. And, as an adult, you realize that the clown's probably not going to harm you. And it's a picture of a clown, let alone it's not a clown standing in front of you or a person that's larger than you are. It's a picture. And yet it brought up a huge amount of anxiety for her. And that's a really good point. Phobias oftentimes happen when we're really young. And what happens is that fear gets embedded in your brain at that age that you were at when you actually experienced that traumatic event or just that fearful event. So if you're 3 years old, imagine how helpless a 3-year-old is. I don't know if any of you are familiar with 3-year-olds, but 3-year-olds, they're pretty helpless, and their emotions are also super intense as well. And so this phobia and this fear gets embedded at that age. And so even though you're 20 years old now and you're looking at this picture of a clown and there's nothing to be afraid of, you still get that rush of emotion and feeling that you had when you were 3 years old. And so that's what happens when people have phobias, and that's one reason why people are so avoidant of phobic things, phobic objects that they have. So a phobia can be about an object, it can be about a situation or a particular activity as well. But usually they start after having a traumatic event and also having an anxiety attack or a panic attack related to that feared object or situation. So phobias definitely develop from bad or traumatic experiences. So they're learned behavior. There's an excellent video that I've added in here, and it's a tough guy afraid of a little pit bull puppy, the cutest, sweetest little pit bull puppy you've ever seen, and the toughest guy you've probably ever seen. He's got tattoos all over, and he rides a Harley, but he's just petrified of little pit bulls, not just puppies. They're treating him with a puppy first because it's a lot less threatening than a large dog. But he developed a phobia about pit bulls because when he was, I think, 6 or 8 years old, he was with a friend who had a new dog, and they went into the backyard to see the new dog, and the new dog attacked his friend and severely mauled his friend. His friend, I think, survived and was okay from it, but it was such a traumatic experience to him that ever since that incident, he's been petrified of pit bulls. And so in the video, he wants to overcome his fear because he feels like he's missed out on a lot of his kids' lives. He hasn't been able to go to the park. He's constantly scanning the environment, checking for pit bulls anywhere he goes, and he's just completely afraid of pit bulls, and he doesn't want to live his life in fear anymore. And so that's a really good reason to want to overcome a phobia. If you're afraid of spiders, you have a phobia about spiders, you can probably avoid that pretty well. But there are others, but if it starts to interfere with your quality of life, that's when you want to change it. If you got offered your dream job and it's on the 20th floor of a tall building and you're afraid of heights or elevators, you could overcome that fear in order to take that job. But it'd be kind of sad to not take your dream job just because of that one fear. Phobias are really treatable. They are the one of the main disorders that we're actually able to treat pretty rapidly, and people really can recover from them. So it's really worth getting treatment for a phobia if you have a phobia that's interfering with your life. So they're learned behavior, though. They start out with a traumatic experience. And classical conditioning is also involved. So you pair that object or situation with fear and or panic and anxiety, that whole reaction that you had to that situation, you pair it with that object. So in the case of the pit bull, that pit bull is paired with this horrific event, and you can't see that pit bull without flashing back to that horrific event. So you pair those two things together just naturally and automatically. Phobias also get reinforced because people are able to avoid anxiety by avoiding whatever it is that they're afraid of. So operant conditioning is also involved in this too, so that you kind of get rewarded for avoiding that situation because then you don't have to deal with that anxiety. However, you're also giving up a lot of other things though that might be a punishment actually. You can also develop a phobia just by watching somebody else that has a phobia and thinking, oh, maybe I should also be worried about that. Or like my other student who was afraid of that clown, watching a really scary movie and feeling really scared and helpless about that can definitely develop a phobia as well. So we all have a lot of fears, and down here there's a whole list of common fears that people have. But the fears don't become phobias unless they start to get paired with anxiety attacks and panic attacks and with feelings of panic. So a lot of people have fears of animals. This is like 22% or so, but only a small portion of those people actually have a phobia about animals. And many of these people that do have a phobia may have had a pretty traumatic experience due to that. I thought it was really interesting that you can have a fear of blood or a blood phobia. And I actually think I qualify for this. I'm not a fan of blood, and seeing blood, I would never make it as a nurse or a doctor. But phobias develop from fears, but often from really bad experiences as well. And some of our phobias also kind of are natural fears. I mean, we're naturally afraid of mice and snakes and, fearful animals and things like that. So we don't necessarily have to overcome those fears. But if it's impacting your quality of life, that's when you want to look at maybe getting some help with that phobia. So what's the best way to overcome your fears? You guys probably know the answer to this, and it's actually facing them. So facing your fears, and if you watch the video with the tough guy with the pit bull puppy, what they're doing is actually exposing him to the pit bull puppy, and they use a puppy because it's much less threatening than a large dog, and it's they're trying to help him get desensitized to the idea that not all pit bulls are vicious, and certainly a puppy is not vicious, and trying to get him comfortable with that situation. And that treatment is called systematic desensitization. It's also called exposure therapy as well. Exposure therapy is more of a modern term now, but systematic desensitization, I think, is what your book calls it. And what it is taking small steps to get comfortable with that feared object. So if you're afraid of spiders, you might get comfortable looking at pictures of a spider. You might get comfortable touching a picture of a spider, maybe looking at a spider behind in a glass case, watching a video of spiders. I don't know. So if you wanted to overcome your fear of spiders, you could do that. And what you would do is take these gradual steps to getting comfortable with each situation with a spider. The counselor would also help you with relaxation techniques and ways to cope with your anxiety as it comes up, so that you don't experience a panic attack. So systematic desensitization is a behavioral treatment that gradually exposes the person to whatever it is that they're afraid of. And the person actually comes up with what we call a hierarchy of what it is they're afraid of. And then we gradually expose them, because some people might have difficulty looking at a picture. Some people might be okay with the picture and touching the picture. So we don't waste time on that, but we can move on more quickly depending on how where those fears are. There's a great program at Sky Harbor Airport, Captain Ron's Fearless Flight Program, and it actually helps people overcome their fear of flying. And this is a fear that a lot of people have, and it's kind of important to overcome in our modern world. If you have a job, you may have to travel for business. Just going on vacation, it's kind of nice to be able to fly, but many people have a pretty strong fear of flying. And what this is a systematic desensitization program. And what they do is they have a decommissioned airplane on the tarmac somewhere. I don't know if it's at Sky Harbor or not, but people are actually able to board the plane and sort of pretend like they're going on a flight and really go through the whole routine of checking in, going through security and all of that, and getting comfortable with all those processes. Because if you think about it, anxiety is something that sort of builds on itself. And when we have an event coming up, we have a final coming up or something that we're stressed out about it, how early do we start stressing about that? Usually, weeks, sometimes 2 weeks ahead of time. Every time we think about it, we have a small stress reaction. And what we want is, to interrupt that building of the stress, because what happens is that stress just builds and builds until you have a full-blown panic attack when you get there. So what we want to do is get people comfortable with each little stage until they actually completely overcome their fear of it. This is an example of a hierarchy for somebody that's afraid of dogs. So they might look at dogs, they might watch an Animal Planet video, they might go to a dog park and watch from behind the fence there. Getting more and more comfortable with the dog before they actually maybe encounter a dog or pet a dog. But once they get past that fear and recognize that they don't have to have that panic every time they encounter a dog, they can very much overcome those fears. So we call it rapid exposure therapy too. That's gaining in popularity, and it works on the same principles as systematic desensitization. The video with the tough guy and the pit bull puppy makes it seem like it's really quick and really, in a half hour or whatever the show was. But there was a lot of work that went into therapy before the video and then even after the video as well. But it does work remarkably well. So phobias are one of the disorders that we really have a lot of success in treating. Social anxiety disorder used to be called social phobia, and I kind of prefer the term social phobia, but they're calling it social anxiety disorder, and it's also pretty common, and it's a fear of social situations, and it's a fear of being judged by others or being embarrassed or humiliated in a social situation. And generally, it starts because a person was embarrassed or humiliated and traumatized by a social situation, and so you never want that to happen again, so you avoid it. And what happens is people end up avoiding life and interacting with other people, and often can become depressed and have more severe anxiety. So social anxiety can be a problem for a lot of people, and it's not just shyness, it's really extreme shyness. Sometimes it can manifest itself in not feeling comfortable eating in front of other people, not talking in public situations, and this is not like a speech or anything. This is just sitting in a group of people and speaking up about a topic that everybody's talking about. Oftentimes people don't want to say the wrong thing, or so afraid of saying the wrong thing they just don't say anything. So, and people would probably avoid public situations and parties and concerts, and the more you avoid, the worse your anxiety gets, and the worse the worse your life gets, really. The more limited, I guess, your life gets, and that's where you really want to seek out some help. um, there are many celebrities that have shared that they coped with social anxiety disorder. Zach Greinke was a pitcher for for the Diamondbacks. I don't know where he's at now, but he kind of had a bad reputation because he didn't like to talk to fans or to newscasters, and he shared that he really suffers from social anxiety disorder. That he was just petrified of talking to anybody and saying the wrong thing, and he just panicked, and so he never was able to do that. And that's not uncommon. And you'd think somebody that's a performer or an actor or actress that they wouldn't have that kind of anxiety, but they really do, and they have to overcome it. Adele has shared that she suffers from social anxiety and panic attacks, and many times when she would perform, she would have a panic attack right beforehand. A lot of performers also sort of take on a different persona when they perform that helps them get past that anxiety, which is not necessarily a bad coping mechanism at all, but it can be really challenging, especially when you're in such a high stress performance situation. So generalized anxiety disorder is more of a moderate level of anxiety, and this is where people worry all the time about everything. And you guys may know people like this. You might be one of those people. Sometimes I think I might be one of these people where you worry about things all the time, whether there's really anything to worry about or not. If there's nothing to worry about, you find something to worry about, right? It's highly comorbid with mood disorders. So, the more depressed you are, the more anxious you are, the more worried you are, the more you feel overwhelmed by things. So definitely occurs a lot with depression, but it has to be something that is lasted longer than 6 months, at least 6 months. It's often just a chronic condition. It's almost a personality trait where the person is that's just who they are. They constantly worry about everything. And there are ways to manage this kind of anxiety, mostly with counseling and therapy, and really monitoring your thoughts, and not giving into that anxiety, and focusing on that anxiety too much, and really dismissing some of your worries. And we'll talk a little bit more about treatments when we get to obsessive compulsive disorder. So panic disorder is one of the more severe anxiety disorders, and it's where people experience unexpected panic attacks, and they constantly worry about having another panic attack, because a panic attack is a horrible feeling. Many of us have had an anxiety attack when we're stressed out about stuff. Right now you guys are probably very stressed out about finals and projects that you have to do, and it wouldn't be uncommon that you wake up in the middle of the night and your heart's racing and you feel kind of sick to your stomach, and you're stressed out, and you know that you're stressed out, and you're stressed out about school. And typically you can sort of talk yourself down from that. So anxiety attacks tend to be a little bit less severe than panic attacks, and they're less they don't last as long. But they're still pretty uncomfortable and not good, but you know where they're coming from. The scary thing about panic attacks is that they seem to come out of the blue. The person's just going along with their normal daily routine, and all of a sudden they're hit with this horrible sense of panic. So a panic attack is much stronger and lasts much longer than an anxiety attack, and often the person is so taken off guard by it, and also so afraid that they're going crazy, that there's something physically wrong with them, that that not only does that initial panic grip them, but they also increase that level of panic by how they're thinking about that sense of panic as well. But it's a really horrible feeling, a horrible situation for people. And one of the things that we do try to train people that have panic attacks is that whole it's really your sympathetic nervous system kicking in. It can be really terrifying, and it definitely can be very debilitating. But what it is your sympathetic nervous system kicking in. And what happens is your sympathetic nervous system, it thinks it's sensing some sort of danger. It's kicking in all of those survival instincts. Your heart rate is increasing. You might start sweating. You might have shortness of breath. One of the things that people, when they first have a panic attack, their chest tightens up and they feel a lot of chest pain, and they really think that they're having a heart attack. And most of the time, people will go to the emergency room only to find out later on that it was just a panic attack, which is not necessarily very reassuring. But it's your sympathetic nervous system kicking in. And one of the things that I was trying to say that we teach people is that your sympathetic nervous system is going to kick in, and automatically it will come back down eventually. And usually it's 2-3 minutes or so that you have to suffer through until it actually subsides. But it will actually subside on its own no matter what you do. When we have an anxiety attack and we talk ourselves down from that anxiety attack, it also calms that sympathetic nervous system and shortens up that anxiety attack. But a lot of times when people have panic attacks, they're so taken off guard and they're so afraid that something's really wrong with them, and they start to dwell on that, and that can actually increase those symptoms of panic as well. It affects about 2 to 3% of the population, and it definitely seems to have a genetic component. There's estimates about 40 to 48% of heritability, which means if you have a parent that has panic disorder, you get a 50-50 chance of having it yourself. So panic attacks and the avoidance of them are the basis of most anxiety disorders. In the next video, I'm going to talk about obsessive compulsive disorder, and I also have a really good video of somebody with obsessive compulsive disorder and also having a panic attack, so you can sort of see what that looks like, which it doesn't really look like a whole lot. When you watch the video about the tough guy with the little pit bull puppy, he's actually having a panic attack when they introduce him to the puppy, but it doesn't look like much, but to the person that's having that panic attack, it feels like, the whole world is crashing in around them and that everybody can see how messed up they are. And it's truly not the case. It doesn't look like a lot from the outside, but from the inside, it definitely feels like a lot. So I'll look forward to talking to you in the next video.